Depression. Depression isn't just feeling down. It's a complex mental illness that affects mood, energy levels, and daily functioning. Individuals with depression may experience changes in appetite, sleep disturbances, and difficulty concentrating, making even simple tasks seem daunting. For instance, someone grappling with depression might withdraw from social activities, struggle to find joy in hobbies, and feel a pervasive sense of hopelessness. Treatment for depression often involves a combination of therapy, medication, and lifestyle adjustments aimed at managing symptoms and improving overall well-being. Anxiety disorders. Anxiety disorders encompass a range of conditions characterized by excessive worry, fear, and physical symptoms, such as rapid heartbeat and sweating. People with anxiety disorders often find themselves trapped in a cycle of anxious thoughts and behaviors that can interfere with daily life. For example, someone with panic disorder may experience sudden, intense bouts of fear accompanied by physical symptoms, leading them to avoid situations that trigger anxiety. Treatment typically involves therapy to learn coping strategies, medication to alleviate symptoms, and lifestyle changes to reduce stress and anxiety triggers. Bipolar disorder. Bipolar disorder is a mood disorder marked by extreme shifts in mood, energy, and activity levels. Individuals with bipolar disorder may experience manic episodes characterized by heightened euphoria, grandiosity, and impulsive behavior, followed by depressive episodes marked by profound sadness, lethargy, and feelings of worthlessness. These mood swings can have a significant impact on relationships, work, and daily functioning. However, with proper treatment, including mood-stabilizing medications, therapy, and lifestyle adjustments, individuals with bipolar disorder can effectively manage their symptoms and lead fulfilling lives. Schizophrenia. Schizophrenia is a severe and chronic mental disorder that profoundly affects a person's thoughts, emotions, and behavior. Symptoms may include hallucinations, delusions, disorganized thinking, and social withdrawal. For instance, someone experiencing auditory hallucinations may hear voices that are not real, leading to distress and confusion. Treatment typically involves a combination of antipsychotic medications, therapy, and community support services to manage symptoms and improve quality of life for individuals with schizophrenia. Obsessive-compulsive disorder, OCD. OCD is a mental health condition characterized by intrusive unwanted thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, aimed at reducing anxiety or distress. Common obsessions include fears of contamination, doubts, or intrusive thoughts about harm, while compulsions often manifest as rituals like excessive hand washing, checking, or arranging objects in a specific way. These behaviors can significantly impact daily life and relationships. However, with treatment, which may include cognitive behavioral therapy, CBT, exposure and response prevention, ERP, and medication, individuals with OCD can learn to manage their symptoms and improve their quality of life. Post-traumatic stress disorder, PTSD. PTSD is a mental health condition that develops after experiencing or witnessing a traumatic event. Symptoms may include flashbacks, nightmares, hypervigilance, and avoidance of triggers associated with the trauma. For example, a combat veteran might experience intense anxiety and relive traumatic memories when hearing loud noises resembling gunfire. Treatment often involves therapy, such as cognitive processing therapy, CPT, or eye movement desensitization and reprocessing, EMDR, to help individuals process the trauma and regain a sense of safety. Attention Deficit Hyperactivity Disorder, ADHD. ADHD is a neurodevelopmental disorder characterized by inattention, hyperactivity, and impulsivity that can impact academic, occupational, and social functioning. Individuals with ADHD may struggle with maintaining focus, organizing tasks, and controlling impulses. For instance, a child with ADHD might have difficulty sitting still in class, often interrupt others, and frequently lose belongings. Treatment typically involves a combination of medication, behavioral therapy, and accommodation to help manage symptoms and improve functioning. Autism spectrum disorder, ASD. ASD is a developmental disorder that affects communication, social interaction, and behavior. Individuals with ASD may have difficulty understanding social cues, show repetitive behaviors, and have narrow interests. For example, a person with ASD might prefer structured routines and struggle with changes in their environment. Treatment focuses on early intervention, behavioral therapy, and support services tailored to the individual's needs to enhance social and communication skills. Borderline personality disorder, BPD. BPD is a mental illness characterized by unstable moods, relationships, and self-image, often accompanied by impulsive behavior and intense fear of abandonment. Individuals with BPD may experience rapid shifts in emotions, engage in self-harming behaviors, and have unstable interpersonal relationships. For instance, someone with BPD might engage in reckless spending or have frequent intense conflicts with loved ones. Treatment typically involves dialectical behavior therapy, DBT, medication, and psychotherapy to help regulate emotions and improve coping skills. Eating disorders, such as binge eating. Eating disorders are mental health conditions characterized by unhealthy behaviors surrounding food and body image. Anorexia nervosa involves severe restriction of food intake, leading to significant weight loss and distorted body image. Bulimia nervosa involves cycles of binge eating followed by purging behaviors to compensate for overeating. Binge eating disorder entails recurrent episodes of consuming large amounts of food without purging. These disorders can have serious physical and psychological consequences if left untreated. Treatment often involves a multidisciplinary approach, including therapy, nutritional counseling, and medical monitoring to address underlying issues and promote recovery. Substance use disorders, including alcohol use disorder, drug abuse. Substance use disorders involve the recurrent use of alcohol or drugs, despite negative consequences on health, relationships, and daily life. For example, someone with alcohol use disorder may continue to drink excessively despite experiencing liver damage or relationship problems. Treatment typically includes therapy, support groups, and medication-assisted treatment to address both the physical and psychological aspects of addiction and promote recovery. Dissociative disorders, such as dissociative identity disorder. Dissociative disorders involve disruptions or gaps in memory, consciousness, identity, or perception of reality. Dissociative identity disorder, DID, is characterized by the presence of two or more distinct personality states, often as a result of severe trauma or abuse. For example, a person with DID may experience periods of amnesia and find themselves in unfamiliar places without remembering how they got there. Treatment usually involves therapy to help integrate dissociated identities and process traumatic memories. Conduct disorder. Conduct disorder is a childhood or adolescent onset disorder characterized by a pattern of behavior that violates the rights of others or societal norms. Symptoms may include aggression towards people or animals, destruction of property, deceitfulness, and theft. For example, a teenager with conduct disorder might frequently skip school, engage in fights, or vandalize property. Early intervention and treatment, including therapy and family support, are essential to prevent escalation into more severe antisocial behaviors. Oppositional defiant disorder, ODD. ODD is a childhood disorder characterized by a persistent pattern of disobedient, defiant, and hostile behavior towards authority figures. Children with ODD may argue with adults, refuse to comply with rules, and deliberately provoke others. For instance, a child with ODD might frequently disobey parents' instructions or become easily annoyed or angered by requests. Treatment often involves parent management training, therapy to improve communication and problem-solving skills, and school-based interventions to address behavioral issues. Major neurocognitive disorder, formerly known as dementia. Major neurocognitive disorder is a progressive decline in cognitive function, including memory loss, reasoning, and judgment, severe enough to interfere with daily life. Common causes include Alzheimer's disease, vascular dementia, and Lewy body dementia. For example, someone with major neurocognitive disorder may struggle to remember recent events, perform familiar tasks, or recognize loved ones. Treatment focuses on managing symptoms, providing support to caregivers, and improving quality of life.